Greetings. Welcome, Dr. Mishra, joining the Global Healing Network there in Mumbai, in India. And I'm so glad to have an opportunity to interview you because you are a really prominent practitioner in India despite your youth. And of course, you have traveled around the world lecturing. And I'm
Yes,
particularly interested about your type of homeopathy, which is called predictive homeopathy, which is recognized for its scientific basis, is recognized by the United Nations and other bodies. So it's very exciting. And
yes,
I want to make the distinction. There's so many different types of homeopathy and ways to practice homeopathy. One is the
right.
most popular system around the world, right? It's used by more people around the world than any other system. And
Yes,
a lot of times we think about homeopathy for simple things, but you guys are actually treating genetic diseases and a whole range of things. So I'm going to ask you to tell something a little bit about yourself and your training, right? And then we'll talk more about homeopathy.
right. Well, thank you, Dr. Kokai, for having me on this show. It's a pleasure and it's an honor here. Well, to begin with, homeopathy is the largest, I would say, the most prominent system of medicine in India. I think no other country anywhere in the world supports homeopathy as India does. Now, the biggest reason behind this is that the
Oh,
treats the disease from its root cause. Secondly, it is the most safest method of medicine known to mankind. Of course, we all know that the traditional system or the allopathic system of medicine, which we call, has lots of medicines who, if taken for a longer time or a longer period of time, develop certain bad effects or side effects, which can, create problems in the body. But homeopathy is a very, very safe, tried, and tested system of medicine. So, our system of medicine or what we practice is genetic based. So, now it is not related to genetics. I mean, we don't alter the genes, we just try to immunomodulate. It's just like we are balancing the immunity of an individual through homeopathic medications, which are very, very simple and effective.
excellent. So I like to just go into a couple of cases so people have an idea about homeopathy in terms of what it can do from a clinical standpoint. So just
Right.
share with us a case or two.
Yeah, well, this is a very interesting case. This case is about a female around 27 to 28 years of age. She's married, and she consulted me in January 2015 this year, and she had a complaint of bicornuate uterus. Now, for people who get confused with medical terminologies, bicornuate uterus is a type of a very, very small uterus. In short, the reproductive systems are not fully developed. The ovaries, the fallopian tubes, and the uterus are not developed. So, the resultant disease is infertility, that if the female tries to conceive, she won't be able to conceive because of the small uterus.
Hmm.
All her complaints with her sonography reports, her IVF treatment reports, and we started her with homeopathic treatment in January. And just a couple of days back, she gives us a very, very good news that the sonologist who was conducting her sonography has found some improvements in her uterus size. Her ovaries have started to develop. Her uterus has started increasing in size. So what we have done here is we have just stimulated the immunity of that patient, and that patient has started healing itself on its own. So
Well,
this is just a one broad aspect of homeopathy where it stimulates the organ, it stimulates the hormones, it generally increases. Everything increases if you take
No,
homeopathy into account.
I guess what's amazing about that particular case, because that's considered, obviously a genetic condition. And was she
Yes.
having a menstrual cycle prior to you guys working with her?
Yeah, she had a menstrual cycle, but unfortunately, since the past 1.5 years, there was a lot of irregularity in her menstrual periods. So that is the time she consulted the sonologist, and the sonologist then confirmed that she had
A
a bicornuate
bicornuate
uterus
use,
and her
right?
reproductive systems were underdeveloped.
Right. So before I comment on that, I'm going to let you share another case, and I'm hoping you have a case about children because I realize that you deal with a lot of genetic diseases that affect children.
Right, right, right. So yes, this case was again referred to me by a patient who I was treating for a similar condition. Well, in medical terms, we call this condition as cerebral palsy. Now, cerebral palsy in a children is like, if I have to enumerate a symptoms in a very, very short way, it is just like a vegetable. The child was brought to us in clinic on just two hands. The child was not able to hold the neck, was not able to control her body, there was no eye contact, and they had visited all the doctors, prominent doctors in all the leading hospitals in Mumbai, and they were said that there is no treatment available for this condition. You have to live with this problem throughout your life. And they visited us in March 2015, and we started her on homeopathic treatment. And I still very, very nicely remember after 1 month of starting the treatment, the mother came to me and she said, "Doctor, I'm getting goosebumps." I said, "What happened? Should I treat you?" She says, "No. The reason I'm getting goosebumps is that I never could have imagined in my life that I will see my daughter making a proper eye contact with me." So that is what is the beauty of homeopathy. If that you can give it to a mother, for a mother, the most important thing is a child, a contact with the child. So if you can give the mother that love and affection from the child, I think it speaks volumes for
Right.
itself.
Did anything change with respect to the hypotonia, meaning just the loss of muscle tone?
Yes, it has to go in a gradual way. Her eye contact improved, her neck holding came back, she started chewing food, she started swallowing, her shoulder muscles developed, her hand movements have started, her back muscles have developed. All this has happened in a span of 2 months. So
Wow.
she has almost now from a vegetable, she has become more human. Now she is trying to get up from the bed, she's trying to roll on the bed. All these things are improving in her.
That's pretty phenomenal. And I know when we talk about predictive homeopathy, there's an
Yes.
expectation that this is something that's going to happen in a regular fashion. So
Yeah.
I know that you have organized where there are literally camps in India where children that have these kind of genetic problems actually come. And
Right.
your effectiveness in terms of getting these kind of results, I understand, is about 38 or 40%. So
Yeah.
I don't know of any other system that can make that claim. So I hope, I'm sure you guys are inundated with students that are coming
Yeah.
from around the world to study this kind of homeopathy.
Right.
So in India, I know, I'm just curious about what your day is like as a practitioner. How many patients are you actually seeing in the course of the day? How is it structured?
Well, it starts with as we say that homeopathic case taking is a very, very different ball game than the traditional system of medicine. For a patient, for a normal patient or a special patient, we need at least 2 to 2.5 hours of history. We have to sit with the patient, we have to communicate with the patient, what are the feelings, what are the patient suffering from, and on the basis of that, we prescribe medicine which suits the patient. So on an average, we give a new case takes about 2.5 to 3 hours, and a follow up takes almost of 30 to 35 minutes. So in a day, we see almost 60 to 70 patients. Well, that's
That's not just you.
unimaginable. but still, we managed to see so many patients.
Oh my goodness, that's pretty amazing. But I wouldn't expect less just given the population there, you know. So that's fantastic. But so in terms of your relationship with the allopathic, the Ayurvedic community, other systems, how is that coming at this point? Do people see themselves as being adversarial, or are folks trying to work together in the different systems of medicine?
Uh, well, I would say that homeopathy has no problems working with other system of medicine. It is just that other system of medicines don't feel the need for homeopathy. However, there are many doctors here in Mumbai, in India, who do recommend homeopathy to patients. For example, the most commonest condition here is bronchial asthma. So, allopathic doctors are very well aware that homeopathy has got excellent results and excellent cure in bronchial asthma. So we have many MD doctors, pediatricians referring to us for bronchial asthma. So yes, there is a mutual understanding between all the other systems of medicine. And yes, in future also we can hope that many more dreaded conditions which have no cure in allopathy or in other system of medicine definitely can work together with homeopathy.
Right. And what would you say about how many years does it take for a doctor to train as a homeopath to come up to speed, so to speak? I know it's a lifelong learning thing, but in terms of practicing, it is. I mean, how do you guys train and then get out in the field?
Right, like I already told you that India is the only country all over the world which gives more importance to this system of medicine. And like other schools of medicine, we have a bachelor's degree here. We have a 4.5 proper bachelor's course to study homeopathic medicine. We study anatomy, we study physiology, pathology, medicine, all the medical subjects along with the homeopathic system of medicine. So we get 4.5 years of theory training. We have a year of an practical internship, and after that, we are out in the field to treat patients.
Right.
So it's a proper 5.5 years of course, bachelor course.
You know, even at this time, people are still confused homeopathy with herbal medicine. Like they say, I'm going to see my homeopath. It's really an herbal doctor or nutritionist. And I try to get across to people that the homeopathy is something different. Now, I have my way of explaining it, but when you have to explain it to people that don't have really a conception of what a homeopathic medicine is, what do you tell them?
I just simply tell them that the other systems of medicine are trying to find out what are the symptoms. For example, if I have a cold, or if I have a running nose, or if I have a fever, a traditional doctor is going to prescribe me few pills. That is, he's treating my symptoms. But to a homeopathic physician, it is still more deeper. My concern is why that person is suffering from fever. If I treat that person's cause, for example, he was under some mental stress, he was having some petty issues or aggression, and that landed up in fever. So I need to treat his aggression so that the next time if he gets aggressed or if he gets affected by certain emotions, he should not land up in fever or other illnesses. So homeopathy treats the cause. What has started the disease or what has started the process, that is more important for a homeopath.
Right. Well, I'm going to thank you for today. I know it's pretty late there in India, and I certainly look forward to sharing cases with you and just using your expertise. And again, I just wish you all the best. So
thank you so much, Dr. Kokai. It was my pleasure having you here. Namaste.
All right.